Hello, my name is Rosie,
And my name is Alejandro.
and our topic is on public health nursing.
Yes.
So, quick question. What do you think is public nursing?
Nursing care to the public.
I think a public health nurse goes into the community, whether that's in a public health clinic, but basically her role is to educate the public on things that are relevant and keep us all healthy.
So, Alejandro, what is the definition of public health nursing?
I came across this definition, which is basically public health nurses address assets and needs at multiple levels of lives and use a political process to ensure the health of communities. These public health nurses, they work with communities to heal, to partner, to mobilize, support, and bring change about in all the disadvantaged communities. So yeah.
Onto the definition of what public health nurses do. They promote the health and the wellness of their patients and prevent diseases. They find themselves in different settings surrounded by numerous groups of people, and it's necessary for public health nurses or community nurses, as we also call them, to obtain the opportunity to improve or at least maintain the mental and physical health of their patients. This requires many skills involving comprehensive knowledge and ways to bring up the subject at all to the individual and or their family. They have the professional skills to fully utilize their expertise and able to assist their patients. If a public health nurse is not able to necessarily help their patient, they will direct him or her towards another person or organization that will be able to benefit their patient. Another main thing that these public health nurses do is making sure that their patients fully understand what disease or problem that they're associated with, and that their families also understand what they're going through, so that those resources that they may or may not have are out there on the table, and that they understand how they can get to them, and the times of which they need to make sure that they are taking care of their problem, whether it's weekly, monthly, whether it's a screening, or even just monitoring their blood glucose or getting more exercise every day, anything of the sort. So what these public health nurses do, they work with the schedules of different physicians, of transportation, food and nutrition options, clothing, and even interpreters. Public health nurses make sure that they can have all our resources laid out and that they can apply it for every single patient to make sure they get the best care that they can receive, whether they're in a hospital or not. If they're in a clinic or at home, out on the streets, it is important to the public health nurse to do the best that they can to connect the patient from their disease or problem to becoming better and promoting their health and their wellness, and laying down all their options for that, and doing follow-up care and documenting different plans for their patients.
I would like to just continue a little bit more on what Rosie was talking about, just what public health nurses do. They work with low-income communities. And see, the thing is that public health nurses, they obviously advocate for the population, right? And the reason that they work with low-income communities is because they are obviously undervalued and under-resourced. So they're more prone to exhibit just different diseases. One of the things that they could really advocate for is, and really help promote just health, is with HIV and things like that. And just promoting healthcare clinics and fairs for the societies in these low-income communities. They're able to do these head-to-toe assessments, allowing them to at least know if something is wrong or something is that they need help with. It's not something that's just happening locally or statewide or even nationally, but it's happening internationally. And an important place that I found some information on was in Indonesia. It's really important to understand that, well, yeah, they have different things that are happening in Indonesia compared to the United States. Even though in Indonesia their roles are different, and still trying to find clarity in some places as to what they can do, it's nonetheless an important factor to realize that they are still affecting the communities in the urban and the rural areas and promoting the health of the overall population. It's worth noting that the differences between the United States and Indonesia, how the lack of structure has really affected in establishing clarity as to what they can do as public health nurses, when the United States is pretty clear and cut as to what they can do and they should be doing. In the end, both nations public health nurses want to be promoting the health and wellness of their people. But it's so amazing how even over there, their importance is so great, because once again, if I haven't mentioned it as much, how much they mean to the population and for the health and for the thriving of a society. One way that the government is involved in public health nursing is through the Affordable Health Care Act. Since that the Affordable Health Care Act does, as I said before, affects the lives of people in low-income communities by making healthcare affordable to them. So basically, when I bring up the topic about public health nurses and the Affordable Health Care Act, is that essentially the Affordable Health Care Act would not be possible without the public health nurses spearheading the change and the success of it.
So the impact of public health nurses in the community and with individualized care kind of revolves on promoting health and preventing diseases, and the nurses using their statistics and their knowledge of nursing to develop population-based programs and services to help their patients.
See, and that's an important thing to remember about public health nurses, that their impact in different communities overall affects also the jobs of nurses and doctors in the hospital or as a school nurse, because if they're promoting health and wellness in the communities, then there's less patients that are needed and treated in the hospital. And so their importance is amazing, and it's incredible. It's sometimes seen so low, but we must remember that their importance is great.
Yes, and taking those little steps or finding those little things, whether it's a smoking habit or making sure that people are having protected sex, and just guiding people in the way that they care for themselves and maybe even their family members, and making lifestyle changes and choices that benefit their well-being in the end.
So thank you for watching.